Good evening. We will get started. Welcome to the 5th annual celebration of service for the Albert Schweitzer Fellowship of Alabama. My name is Brooke Bowles, and I'm president of ASF of Alabama. Thank you for joining us tonight. In the audience, we have 2020 and 2021 fellows, academic and site mentors, individuals who serve on our governing board as well as our advisory council, and importantly, family and friends of our fellows. While we each have a different connection to this organization, what we have in common is a desire to support these idealistic, motivated, and hardworking graduate students as they continue to improve health, develop as leaders, and create change. After a full year of virtual events, what we can promise you tonight is that you will leave this one feeling inspired and hopeful about the future. As you hear from the fellows and also the recipient of our 2021 Humanitarian of the Year. The order of tonight's events can be seen on your screen, and I believe it was also just posted in the chat. As a technical note, the event is being held in webinar format, so the only faces and voices you'll be able to see and hear are those who are presenting. Before we jump in, I want to make sure and thank some important supporters of ASF of Alabama. We are supported by a wonderful group of colleagues who truly embody the multidisciplinary, multi-institutional academic partnerships that ASF seeks to develop, as well as the cross-sector collaboration between academics and the community. Our advisory council, as you can see here on the screen, skillfully oversees the recruitment, selection, and programming of each class. Then we have our governing board of directors, which is a dynamic group with the responsibility for the strategy, resource building, and financial management to ensure that our nonprofit has a long history ahead. One person that you're not going to see on the screen, and she did not include it in my outline, but a huge shout out to our fearless leader, Kristen Boggs, who has her video off, really orchestrating this whole event. And this challenging year that we've all faced, Kristen has pivoted so well and successfully managed all the programs and administration of this organization. Next, I would like to draw your attention to a very special attendee, and that is Dr. Stefan Cortez. He recently rotated off of our board after serving as president of our program for 5 years. Dr. Cortez is himself a fellow for life with strong ties to the mission of ASF. Thank you, Stefan, for your vision to bring ASF to Alabama and for your leadership to make it a thriving organization. I am honored to step in as president and continue the momentum that you've created. Next, we would like to thank our supporters. It's ultimately because of the financial support of the organizations you see here on your screen that we can provide more than 50 hours of workshops, ongoing coaching, stipends, and project funds, and much, much more. These supporters recognize that within our graduate and professional schools, there are motivated, high-achieving, and idealistic students who are seeking opportunities to not only make an impact while they're in school, but ultimately envision themselves as future professionals and leaders dedicated to serving and empowering vulnerable people to live healthier lives and create healthier communities. We thank them for believing in us and in our model of combining education, hands-on service, and reflection. Each month, our fellows learn from inspiring community educators who help translate theory that they may learn in their classes to real-world applications. That really culminates tonight when we all get to learn and be inspired by a community leader whom the organization selected as our Humanitarian of the Year. Now I will turn it over to Stefan, who will introduce our distinguished guest.
Okay, I hope I can be heard. Yes? Great. Somebody put it in the chat if I'm not audible. Hello, everyone. Welcome. At each of our sites nationally, a local leader is recognized for his or her contributions to the community and the example of a life of service. And it is my pleasure to present the Alabama Schweitzer Award to Mark Wilson, Dr. Mark Wilson. I've known Dr. Mark Wilson for a long time. He's a wonderful person. He became health officer of Jefferson County, Alabama in 2011, overseeing various programs of the Jefferson County Department of Health. Before taking that position, he served on the Jefferson County Board of Health for 3 years and worked for over 20 years as a general internal medicine doctor in indigent healthcare at Cooper Green Mercy Hospital in Birmingham, including several years as an outpatient doctor when I got to know him then, and then as chief of staff. He had earned his Bachelor of Civil Engineering from Georgia Tech and his medical degree from University of North Carolina, Chapel Hill. Since coming to the Jefferson County Department of Health, Dr. Wilson's priorities have included advancing health equity, improving birth outcomes, addressing the drug addiction and opioid crisis, advocating for tobacco-free policies, supporting the development of trails and greenway systems to facilitate outdoor activity, ending the HIV epidemic, and more recently, establishing a strategy to address violence as a public health problem. Dr. Wilson also worked to expand partnerships between the health department and other community organizations to pursue common goals related to public health. Crucially, Dr. Wilson led the Jefferson County, or co-led the Jefferson County Unified Command for the pandemic response here in the county, along with the County Emergency Management Agency Director. And I can say throughout this past year, which has involved a lot of challenge for all of us and trauma, I know from talking to him that Dr. Wilson has felt the weight of all the work that everyone did and the stress of the decisions that he had to make, the calls that he had to make, some of which meant consequences in terms of how we isolated, how we socially distanced, when we locked down, when we wore masks. And those were difficult decisions. And throughout all of this, Dr. Wilson has shown a real strongly felt sense of understanding, appreciation, and even, I think, sadness for the people who've suffered as a result of this pandemic, and felt the weight of that responsibility. And I think for us in choosing him, it very much reflected our shared sense that he had just done extraordinary work for us with extraordinary feeling for the people in this county. So please join me in congratulating Dr. Wilson, who will share some reflections from his own leadership journey. Oh, he's muted. Unmute Mark Wilson.
I think I had to unmute myself. You'd think after all this practice, I would have gotten that little detail. Thank you, Dr. Kertész, for that introduction. I don't think I'm a distinguished guest, but I'm very glad to be a guest nonetheless. When I was a teenager, I envisioned myself actually doing work similar to that of Albert Schweitzer, and I knew who he was at that time. Of course, it was the medical work I was thinking of, not the theological treatises or the music recordings that he did. And I'm certainly not nearly as smart as he was. But it is, for that reason, a very special honor to be recognized with this humanitarian award. So for those of you who are early career or contemplating your career, I want to ask you a question that was once asked of me. Would you rather give a cup of water to one thirsty person, or would you rather feed the 5,000? These are, of course, biblical references, but the general idea is obvious for those of you who are contemplating your future work. This is about whether you would rather emphasize in your work of service to others, focus on the individual, or on the larger population. For me, when I decided to go into medicine, I had a little bit of both of those in mind. I was very driven by a desire to serve the poor, the suffering, the neglected, the forgotten. I'd say that desire actually started when I was a teenager. I had seen examples of missionaries going to very, very poor countries and helping people that were literally starving or suffering from diseases that were where they did not have the treatment. But mainly when I ended up started my first job right out of training at Cooper Green Mercy Hospital, which, as many of you know, is the public hospital for Jefferson County's low income and uninsured population. It's no longer a hospital, but still an outpatient clinic. At that time, my focus really did end up being about the individual because I was doing direct patient care. I really loved that work. It was extremely gratifying to have the opportunity to touch people's lives in such a personal and meaningful way, and to get paid to do it, no less. And for those of you that are in healthcare, I would just encourage you to remember what a sacred responsibility and opportunity that really is. It's amazing to be able to get that close and personal and intimate with people that you just met 5 minutes ago. You know, at that time, I was really just happy to be finished with school and residency training and finally doing what I had wanted to do for many years. But here's what happened. As I tried to take care of my patients in a governmental bureaucracy, which was a public hospital, that wasn't always patient-centered, and where resources were somewhat limited, I pretty quickly started to see the hurdles that patients had to overcome in order to get good care. I also noticed the obstacles in their own lives that interfered with their ability to get their prescriptions filled, or to keep appointments, or even get an appointment, or to eat a healthy diet, etc. So I quickly found that I couldn't really serve my patients as well as I would like to without paying attention to that larger context. First, it was just the context of the clinic and the hospital where I worked, you know, where things didn't always work as well as they should. But as time went on, I started focusing on the larger context, what I now recognize as social determinants of health, or policies, systems, and built environment, public health lingo. Because I cared deeply about the people I was serving, and I clearly wanted to make a difference, and perhaps because I was reasonably conscientious and worked hard, people in leadership positions over me took notice. So after 2 years at Cooper Green, I was asked to be the medical director of outpatient clinics. After protesting that I was too young and underqualified, I ended up serving in that position for 12 years. And somewhere during that time, the health officer and head of the Jefferson County Department of Health at that time asked me to consider joining the health department. Guess what he asked me to think about? He asked me if I would rather give a cup of water to one thirsty person or feed the 5,000. Of course, he was talking about public health as opposed to individual health, or what I was doing, primary care and sometimes hospital medicine. At that time, I really wasn't ready to make that change. I found that what I was doing was quite gratifying. And, you know, like most work, it was not without its frustrations, but it was good work. And I ended up staying at Cooper Green for a total of 20 years. And as was mentioned, I ended up being chief of staff during the latter 3 years of that time. Also, during the latter years of that 20 years, I was asked to be on the Jefferson County Board of Health, which is the board of directors for the health department. And I was also asked to serve as a delegate for the State Medical Association. And because of those things and other things going on, I became more and more interested in the larger policy issues, such as health insurance reform. This was around 2009, pre-Obamacare, as that was all being debated on the national front. And I was very active locally for advocating for a national universal health care coverage otherwise known as single payer system. I had seen in my own work too many people suffering dire consequences from being uninsured. The gentleman with undiagnosed diabetes who delayed care because he had no health insurance and ended up losing his foot, or the young laborer who hurt his shoulder in a car accident and couldn't work for lack of cash required up front to get an operation that could easily restore him to full function. So for me, as you can see, I sort of evolved from a focus on the individual to a focus on the larger context. I evolved into what people now recognize as public health. So when the previous health officer announced his retirement, and several people, including Board of Health members and others that I knew, so they all suggested that I apply for that job of health officer. I only had 2 letters after my name, MD. I didn't have a master's of public health or healthcare administration or an MBA or MPA. And when I was first training and going into my career, I didn't see a need for those things. I wanted to be a medical doctor. I had not planned for a career in public health or to lead a governmental agency. And I'm not saying that you should not be getting formal training in those areas, especially if you know you might need it, like you might be going into public health as I ended up. I would certainly be much better at my current job if I had received more formal training in some of those areas. But what I am saying is that a key ingredient into getting into a position where you can make positive change on a larger scale is passion for other people. You really have to care about people, and you have to be driven by a genuine desire to do good and make positive change, to make things better. So once you get into a position where you can potentially make a difference on a larger scale to feed the 5,000, if you will, I would like to propose, and this has been my own experience, that you need to maintain or cultivate some type of personal connection to those you serve. Don't allow yourself to get too far removed or distance. I sit in an office a lot of the day, and I can tell you, it can be really easy to get distant, to where the things you're trying to fix, the things you're trying to address become abstractions, and you can start not really caring like you should. I think that's why it's really important for a governor to visit a neighborhood hit by a tornado, or a mayor meet with a mother who just lost her child to gun violence, or when the President of the United States calls a family member of a soldier killed in combat. That personal connection is extremely important. For me, since I've been health officer, I've during that time continued to volunteer in a clinic for uninsured people, because I don't do patient care here at the health department. For a while, I mentored some children who lived in dire poverty and whose lives were affected by drug addiction and violence on a regular basis. That made a big difference in how I view things from a public health standpoint. To have that real personal, up-close view of what's really happening in people's lives. Occasionally, I make a personal call to some of the customers of our health department who are struggling to get what they need, or talk to community members who are complaining about pollution or some other nuisance in their neighborhood. I've had the opportunity to get to know some people struggling with drug addiction, or who've lost loved ones to overdose. That really motivates me to do the work of public health. Sometimes at least I make sure I listen to the stories of others, like the stories of our visiting nurses and the mothers they serve in the nurse-family partnership. These up-close exposures, these opportunities to be in other people's shoes are critically important for keeping that passion alive, to help you remember why you're doing what you are doing in the first place. So some of you may choose to focus on feeding the 5,000. The fact that you pursued a Schweitzer fellowship is a sign that you might be headed in that direction. I would argue that while you may choose to do that, you should never forget that one thirsty person. I would encourage you to make it your habit to do that with some regularity, no matter what you end up doing. This is what being a humanitarian means to me, caring for the individual human in a close, high-touch, personal way. This is being human at the deepest level. Then doing whatever you can to change the larger context for the good of humans more generally. So thank you again for this award, and thank you for this opportunity to spend some time with you.
I'm up, and I just want to say, wow, thank you so much for that, Dr. Wilson. It was, I think I speak for everybody when I say it was inspiring, and your dedication to this work came through very clearly. And you know, you said you didn't feel like a distinguished guest. Well, you are, but I'll also encourage you to look at the chat, and you will see some of the comments that our audience proves that they agree with me. I know we can't really clap, but everybody at home, just clap for Dr. Wilson, because if we were a person, that's what we would be doing right now. And I know that there, you know, everybody in the audience is feeling very separated, and you know, we want to be together in order to give these fellows the attention that they deserve after this year. But you can drop a note in that chat box, and that's our way of trying to stay connected tonight. And you can contact them after the fact. Drop them a note, tell them how great they did this year and what a difference that they're making in our community. Okay, what a year it has been. We have all been through challenges that have just really stretched us to the very end of what we can handle. And for no one is it more true than for these fellows who chose their projects in January of 2020, which will forever be known as, you know, right before the pandemic began. So they didn't have a chance to have a typical fellowship experience, but they did have a great fellowship experience, and they have made some major strides and some differences in our communities. And, you know, at ASF, we believe that the world needs more daring leaders. We think our fellows are daring leaders. And Brene Brown said that a daring leader is the willingness to step up, put yourself out there and lean into courage. And I think that is exactly what our fellows did this year, facing a pandemic and a new project in addition to their schoolwork. They have really, really stepped up and put themselves out there and leaned into their courage. And I think I speak for everybody. We're very, very proud of them. But I also want to note that we're going to celebrate our wins tonight and the impacts that our fellows had on our community through their service projects. But we also want to acknowledge that success is also measured in a leader's ability to be self-reflective and to grow from their struggles as well as their successes. I think a lot of times we learn more from those times when we struggle, almost more than when we succeed. There's always an opportunity to learn. So that is my part of the program. Thank you guys so much for being here today and supporting our fellows. They are a stellar group. No doubt our next Humanitarian of the Year will come from our fellow pool. So thanks, Dr. Wilson. Thanks for our fellows. And I'm going to turn it over to our first fellow, CULP. And then she's going to be followed by her peers one after another. So everybody enjoy the program. And again, thank you for being here today.
Hi, my name is Kay Culp, and I'm a graduate student at the University of Montevallo in the field of clinical mental health counseling. My project provided online group counseling services for parents and caregivers of children with disabilities. Caregivers of this population may experience stress due to the many responsibilities they have in order to provide care for family members. This stress, which is known as caregiver burden, may manifest itself in physical ailments such as headaches, high blood pressure, and overall fatigue, and emotional challenges such as feelings of hopelessness, loneliness, anxiety, and depression. My goal was to reduce these symptoms by giving people a caring community of people who could serve as support for each other. Through their involvement with group sessions, participants gained a better understanding of their emotions and the importance of self-care. Most importantly, they developed a sense of community with other parents. As one caregiver shared towards the end of our sessions, I feel that I am better equipped to handle the stress of being a parent. I now understand the importance of having a self-care plan. I never knew how helpful it would be to have someone to talk to. I'm so glad that I signed up. Of course, I credit much of my project success to the support that I received myself. I would like to take a moment to thank Dr. Judith Harrington at the University of Montevallo for her support and guidance throughout this project. I would also like to thank CAHABA Medical Care and Mrs. Charity LAISTER for their gracious hosting of this project during a pandemic. Thank you.
Hi, my name is Katie Ellison, and I am a registered dietitian and PhD student in nutrition sciences. During my fellowship, I worked with a nonprofit called Cooking Well to develop and implement a nutrition and culinary education program in an underserved community. One of our participants who completed it said two very profound things. One, that they are now aware that they can change the disease processes in their life. And two, that they were encouraged and empowered by the other women in the class. This participant now feels less like a product of her environment and has gained a sense of control, which made me realize that building camaraderie is an essential piece of community programs. Schweitzer himself said, "At times our own light goes out and is rekindled by a spark from another person." This fellowship taught me that through camaraderie, we have the spark to take back control of our health. This is also the essence of my project and of Cooking Well, to empower women to take charge of their health through the power of nutrition and the spirit of friendship.
Good evening, everyone. My name is Mani Kamal, and I'm a fourth-year medical student at UAB School of Medicine. And through partnering with Alabama Regional Medical Services, my Schweitzer Fellowship project aimed to increase the rate of HPV vaccinations, a vaccine that prevents cervical cancer in underserved communities in my state. Alabama is actually tied for the state with the most cervical cancer deaths in the country. And this was a really interesting time to do this project because over the past year, we've seen how important vaccines are to mitigate disease as we all face a pandemic. We've also seen how important it is as health professionals to make vaccines available to populations who are at highest risk, which was my goal by focusing on underserved populations with this project. And I learned that the best way to improve community infrastructure and eventually health outcomes and to make these life-saving interventions more accessible is to involve and learn from community leaders. I've learned so much this year about adapting and simplifying processes. My biggest takeaway as a healthcare provider who plans to engage with their community in the future is to take a step back and learn from community leaders and members. They have a lot to teach you if you listen. So thank you so much to the team at ARMS and UAB for helping me, and thank you so much, Kristen. I really enjoyed this and couldn't have done it without y'all.
All right, good evening, everyone. I'm Abby KRAUS, and I'm a second-year medical school student at UAB. With the help of my mentors, I designed the Happy Heart, Happy Mom project, which became my small contribution to combat maternal mortality in Alabama. Alabama has the third highest rate of maternal mortality in the country, and the leading cause of death in the year after childbirth is cardiomyopathy, a form of heart failure. Despite this, little is known about the struggles women with heart disease face a year after childbirth. Could you imagine worrying whether your heart could handle the demands of caring for a new child and supporting your family? This is a difficulty the women with whom I work felt every day. My project aimed to uncover the barriers women with heart disease face a year after childbirth. I surveyed women who'd recently given birth at UAB, and then based on their survey answers, I would connect them with local resources to provide for their unmet need. For example, one of the women had a son who had a milk allergy. She could not breastfeed and had to purchase expensive specialty formula. I quickly realized that this was an extra but necessary expense that was placing stress on her budget. I was able to connect her with coupons and other resources to get her milk at a discounted price. It was truly an honor to be allowed into the lives of such strong women. Albert Schweitzer once said, "Happiness, that's nothing more than good health and a poor memory." I've learned so much from this fellowship that celebrates Schweitzer's life, but I disagree with him on this. These women taught me happiness is a choice. These women chose to be happy despite their health struggles, and they chose to remember the responsibility to their family and new child. Thank you.
Hi everyone, my name is Sheila. I'm also a medical student here at UAB. And this past year, I worked with the Adult Spina Bifida Clinic at Spain Rehab here to develop a bowel management protocol for adult spina bifida patients here in the hospital system. So in med school or in any sort of grad school, it's just so easy to lose sight of what you're working towards, especially when you spend so much time with your head in the books or, you know, in a ton of Zoom lectures every day. But the Albert Schweitzer Fellowship really gave me an opportunity to put my passions towards a more tangible goal by working through this project. And it's been such a great experience because it's made me motivated to even continue working even harder, because it's allowed me to see the impact that helping community in such a direct manner can have, even if it's in such a small way like our projects. But it's made me strive to do this in even bigger fashion through pursuing my career. The Schweitzer Fellowship has taught me a lot of things, including the importance of planning, the importance of patience, but most importantly, especially in this past year, the importance of how to adapt in situations that may be continuously changing. For me personally, this was a continuously trial and error process, and one that I'm continuing to work on now. And it forced me to check my own limitations, communicate them to everyone involved and all the parties that I was working towards. And it also made me get used to asking for help and understand that that's okay and everyone needs help sometimes. And in the past year, I've learned a lot, and I hope to keep these skills with me as I move forward to pursuing my own career in the future. So thank you all very much.
Hey y'all, my name is Greer McCollum. I am a student in UAB at the School of Public Health in the Health Behavior Department. I started off my fellowship was at One Roof, which is the homeless continuum of care here in Birmingham. I started off my fellowship with a massive goal in mind. I basically wanted to overhaul the youth homeless service system in Birmingham. It didn't take me long to realize that this would be impossible, especially during a pandemic. So, with the help of my academic and professional mentors, I continually narrowed my focus to its three essential elements: implementing a youth homeless needs assessment, bringing together a group of people to meet regularly who are interested in ending youth homelessness, and strengthening the ability of homeless service providers to genuinely listen and respond to the needs of instably housed young people through a youth advisory council. This whittling down process is giving me an appreciation for three timeless idioms that will serve me well as a human service employee. Work smarter, not harder, because you'll always have too much to do. Don't let perfect be the enemy of good, because sometimes good is good enough. And many hands make light work, because in professional life, you'll always need help along the way. So thank you all for being here. And I really loved my year.
Hello everyone, my name is Harley Moore and I'm a third-year pharmacy student at Auburn University Harrison School of Pharmacy. For my fellowship project, I partner with the Auburn Campus Food Pantry that's housed within Auburn Cares to address food insecurity on Auburn's campus. The Albert Schweitzer Fellowship has been an amazing year full of learning experiences, many successes, but also a couple failures. The fellowship project has taught me to continue to push towards my goals, regardless of the difficulties I face day to day. Before the fellowship, I was afraid of failures. I was afraid of not reaching the bar that I met, but through this program, I've learned how to take those perceived failures and use them as stepping stones to help me adjust and move forward. When I think back to the beginning of the year, I wanted to advocate for students' basic needs by implementing campus-wide policy changes to address those needs. But I quickly learned that I needed a team of allies to help me implement those interventions. I was encouraged to advocate, and through that, I was able to implement a new hunger screener at the student counseling services to help screen for food insecurity for our own students. And now I'm excited for the implemental impact that I was able to lay and for the students who can come after me to help build that change. I know I'll be a better clinician because of this fellowship, and in my future practice, I may not always have the correct answer. but I will know how to use those experiences to help the next patient that comes later. Thank you all for joining today and sharing your time with us.
Good evening, I'm Emily Munn and I'm from Auburn University School of Kinesiology. This year was one filled with hardship and loss for everyone. Our world shifted around us. Children were not spared from this hardship. Schedules changed, school looked differently, friendships were even harder to find. I had the challenge and honor of setting up a COVID-safe and completely inclusive Girls on the Run program here in Lee County. In the weeks leading up to the program, I feared my impact would be minuscule given all that was going on. But one beautiful afternoon, my girls proved me wrong. You see, I had multiple girls with disabilities on my team. And after explaining to my typically developing kids some of them got nervous looks. One even asked me how she could even talk to someone with a disability. The coaches and I typically voted on a girl of the day at the end of practice. But on this day, one of the girls pulled me aside and asked if she could give it. With confidence, this runner walked up to the middle of the group and said, "I would like to give our Girl of the Day award to." She then named one of our girls with Down syndrome. She continued, "Not only does she work hard every practice, but also she tries to make us smile. And no matter how hard the workout is, she is smiling. I want to smile as much as she does, and that's why she deserves Girl of the Day." In this moment, it was all worth it. The mask, the running 6 feet apart, the weeks of phone calls to parents, promises of safety. My girls had gotten it, completely unprompted, without any adults they showed true inclusion. Not to mention this girl's disability being the reason. Just true honor and friendship. Thank you all.
Hello, everyone. My name is OSPINA. I'm with the UAB School of Dentistry. My project was to introduce Spanish into the curriculum at the UAB School of Dentistry. When I first conceived this project, I was just hoping my classmates wouldn't hate me too much. I was in essence giving them more work in an already difficult caseload. And to be sure, there were some grumblings. But overwhelmingly, I felt the support of first the faculty and then the students. After the classes rolled out, I had classmates stop me and say how appreciative they were that the content was being made available. I feel blessed to be surrounded by future dentists that don't mind putting in the extra work, who understand we are here to help patients at the end of the day. Just today in clinic, one of my classmates told me that I was able to use the vocabulary I learned with a Spanish-speaking patient. She had saved all the documents that I had provided and was going to use them as reference in the future for all of her Spanish-speaking patients. What I gave them was just the first step in treating our Spanish-speaking patients with the same quality we do for all of our patients. But after finishing up this project, what they gave me was optimism that they will continue to improve their interactions with their Hispanic patients. And that leaves me hopeful that we can do so much more than we are currently doing for our Hispanic community. Thank you.
Good evening, everyone. My name is Jean-Paul OSULA, and I'm a second-year medical student at the UAB School of Medicine. When I began my Schweitzer journey, which feels like not too long ago, I was somewhat worried about what I had gotten myself into. Looking back over the year, I would say I was right to be worried, not because of anything to do with the project itself, but rather due to the difficulties that many of us had to face dealing with reaching our communities in an isolated world. Dealing with the many disruptions we all faced due to COVID throughout the year was difficult, to say the least. With the help of my mentors, I spent time on a career exposure project for students in the Birmingham City School District. And throughout the year, I struggled to find consistency in both scheduling and communicating with teachers. For example, in my first career exposure session, I had 40 students in attendance, while in my second session, I had none. Despite these struggles, I'm happy to have gone through all of them because they have allowed for more personal growth than I could have imagined. The resiliency that was required throughout my project pushed me to become more confident in myself as I tried new things through Zoom and other technology. The isolation forced me to be more outgoing, making connections with healthcare professionals, teachers, community members, and students that I may not have reached out to otherwise. And most importantly, I believe that by going through these difficulties, it allowed me to improve my project continually rather than becoming complacent, resulting in a more positive experience with the students and the teachers than I ever could have expected. Thank you, everyone.
Hello, everyone. My name is Maya Waltuada, and I'm a Doctor of Nursing student at UAB School of Nursing. For my project, I partnered with Nurse Family Partnership of Central Alabama to address postpartum depression among first-time mothers. In the past year, I've had the opportunity to partner with other professionals and gained access to resources that benefited the population I served. For example, environmental health, shelter services, and adoption services that were outside of my professional domain. But because some of my clients needed these services, I was able to learn about them and help my clients by working with professionals in that field. Schweitzer once said, "Do something wonderful, people may imitate it." I'm glad to say that one of my clients, who recently graduated from Nurse Family Partnership Program, is excited and she's willing to be the group administrator for continuity. According to her, she was happy to be in the group and would love to extend same knowledge and experience she gained to other first-time mothers. I've learned that through work exchanges, together we advance a sense of trust that deepens our ties with other professionals and the community we serve. Thank you, everyone.
Good evening, everyone. I'm HADIYAH, a Master of Public Health student concentrating in maternal and child health at the University of Alabama at Birmingham. As soon as I heard about the Schweitzer Fellowship during orientation at the UAB School of Public Health, I knew I had to apply. As a Birmingham native, my goal was to plant positive seeds within the communities dear to my heart, and I believed in myself and my leadership capabilities. But I wanted to learn more about how to execute properly and how to channel my passions and ideas. My project focused on early and middle adolescents, a population that was trying to make sense of life events like gun violence and other trauma whose young age and few opportunities for conscious intervention made it challenging. Utilizing trauma-informed creative arts, I introduced youth in Birmingham to self-awareness exercises dedicated to helping them grow into resilient and emotionally intelligent members of society. My participants quickly became my babies, and they regularly reminded me of what my work meant to them. And now I have a small token of appreciation that I was given on my final day from one of my babies. Her name is Evelyn. She's an exceptional young lady. And she wrote this kitten and she drew, "Be like a mother who cares for her young kids." So that meant a lot to me to see that, to understand that they saw me in that sort of capacity. So that made me happy. And I felt it was my duty to maintain my wellness to serve them the best. Thankfully, I was able to use my own self-confidence, resilience, and open mind to carry me through this experience, along with the motivation and guidance of my mentors, Dr. Strang, Ms. LACRECIA Day and the Family at Impact Family Counseling, Ms. Gunn and Tarrant High School, my Schweitzer peers, my family, and of course, my babies. Looking back, I've realized that the same traits I hope to develop with them, such as self-confidence, resilience, and an open mind, are what carried me. And this transformed the way I view global health, and I'm thankful to have learned and taught these lessons through my Schweitzer experience. I will be sure to utilize them in my work as a medical professional and public health professional. Thank you.
Good evening, everyone. My name is Bhumika, and I'm a final year dental student at UAB School of Dentistry. My Schweitzer project for this year is Healthy Eating with My Plate program for UAB grad students. My time as a fellow has been a period of growth and constant learning throughout the year. Healthy eating is very crucial for overall health as a student, especially, and mental well-being. All the participants' active participation in cooking demonstration and other presentations and enthusiasm by preparing at least one meal by themselves and sharing pictures with me and taking quizzes, etc., inspired me to develop new lessons that had a great impact in their lives. Their willingness to follow me reinforced my passion to help others. Once I read Schweitzer's quote, and now I believe purpose of human life is to serve, to show compassion, and the will to help others. As a future healthcare professional, as a dentist, I would actively engage all of my patients in improving their oral health as a team approach. And I would like to thank my site mentor, Ms. Debbie Morgat, and my academic mentor, Dr. RAQUEL Mazer, for their constant support and motivation. Thank you.
Hi, everyone. My name is Tanya Nix, and I'm a nurse practitioner at UAB Hospital, and I'm currently completing my DNP at the School of Nursing at UAB. I grew up in Birmingham, but I've learned so much more about the Birmingham community and about myself serving with the Foundry Clinic, which is run by UAB School of Nursing. It's a medical clinic that serves adults recovering from substance abuse. While transitioning their clinic's paper charting to electronic medical records, I was impressed by the professionalism and respect of the providers and their relationship with the patients and the motivation and respect that the clients had from their providers. I learned a lot about substance abuse, the impact that it has on the patient's self, their family, their finances, and their employment. I was very honored to help in this transition of going live with their clinic's EMR and knowing that this will make a big impact in improving the patient's health long-term. It was very rewarding. I already carry what I have learned as an Albert Schweitzer Fellow into my practice as a nurse practitioner. I've practiced for 30 years, and I've used electronic medical records during that time and saw the transition from paper to electronic medical records. But I did learn and have appreciation of the important role it plays to improve care for the patient. And I'm more attentive in my clinic setting now in what I need to include in the patient's chart to communicate better with the providers. I want to thank Dr. Bowers for encouraging me to be a part of this fellowship and introducing me to it and encouraging me to be enroll in the DNP program. And thank you to Tanya Judson, who is with the School of Nursing that has worked, that I've worked with transitioning the paper charting to the electronic medical record. And thank you, Kristen, for all of your support during the last 14 months, especially during the craziness with that we've all dealt with. Thank you.
Hi, everyone. My name is Lita Wagoner, and I'm a law student at the University of Alabama School of Law in Tuscaloosa. Over the past year, I've been working on the Rural Health Justice Project, which is a medical legal partnership between Legal Services Alabama and a series of rural health clinics in Alabama's Black Belt region. Imagine that you are a healthcare provider in rural Alabama. You've noticed that many of your patients are facing not only health problems, but also problems related to poverty. One patient has so much debt that she can't afford her prescriptions. Another patient shares with you that he's being evicted from his home. You worry that these patients are not able to focus on their health when they have these legal problems. You really wish you could help, but you don't know what to do. My project empowers healthcare providers to refer patients to legal services for free civil legal help. I trained the health clinic staff on identifying legal issues, and I created materials for patients while they're in the waiting room. We also piloted some virtual legal clinics staffed by law student volunteers. I'm pleased to share that Legal Services has hired an intern to continue this project over the summer after I graduate. Working on this project during the pandemic taught me to be more flexible as well as more compassionate towards myself and others. As Albert Schweitzer once said, eventually all things fall into place.
Until then, laugh at the confusion, live for the moments, and know that everything happens for a reason. Thank you all for supporting me along this journey.
Wow, what an amazing group. While your projects may have been different, you displayed similar traits of perseverance, positive regard for your participants, hard work, and compassion. I'd like to make a toast to each of you, so please get your celebration baskets out, and you'll find some sparkling cider where you can pour for yourselves in a glass. So while you do that, I'd like to thank some important people here this evening. We know that fellows benefited from others who saw and nurtured their potential. And so I want to thank all the mentors who you see listed here. Each of the fellows, they helped each of the fellows problem solve and develop personally and professionally. In particular, I'd like to highlight the recipients of this year's Mentor Awards, where we will also toast. As this year's Outstanding Community Site Mentor, Dr. Candace Knight works as a professor in the UAB School of Nursing and serves as the director of the Nurse Family Partnership of Central Alabama. Dr. Knight's mentee said that Dr. Knight is a true leader who leads by example, and she always wears a smile, even when things get tough. This year's Outstanding Academic Mentor, Dr. Deborah Bowers also works as a professor in the UAB School of Nursing. Her mentee stated that Dr. Bowers has been a mentor to me prior to starting the Albert Schweitzer Fellowship and my DNP program. Her encouragement led me to enroll in the DNP program and also the Albert Schweitzer Fellowship. She has always had a positive attitude and is always available to listen and offer encouragement and guidance. For each of these mentors are people who embody this quote by Albert Schweitzer. And we thank them and all the others for nurturing and the ideas of our fellows this year. Okay. On that note, we'd like to bring back on screen all of our 2020 fellows, Drs. Wilson, Bowers, and Knight, and toast them for the examples they set and shared with us this evening. Dr. Schweitzer once said, to the question whether I am a pessimist or an optimist, I answered that my knowledge is pessimistic, but my willing and hoping are optimistic. Thank you all for giving us reasons to be optimistic. Cheers to you all.
Thank you, Prince, and cheers indeed. I am particularly impressed with everyone's projects, but also with just the humility that each of you young leaders is showing. Congratulations. I now have the pleasure of helping our 2020 fellows transition into being Fellows for Life, the name we give a student who has completed the initial year of service. Fellows, in your celebration baskets, you received a certificate acknowledging that you completed your year of service. This is a small memento that recognizes the enormous amount of effort we know you put into this past year. If you'll go ahead and get that certificate out, and Kristen wants to take a group picture of everyone holding their certificate. Kristen, if you can let me know when that is done.
All right, thanks everyone.
Oh, thank you. Also in your bag, you'll find a Schweitzer Fellowship lapel pin, a symbol of your transition to now being Fellows for Life or alumni. I applaud you not only for the time and effort you contributed to your organizations and the individuals served, but also for your willingness to be changed by your experience. I believe that was a theme tonight that we heard from so many of you, that this year you had to adapt and be flexible and really focus on reflecting and learning and growth. We hope that the process has bolstered your sense of commitment to working with people in need and has equipped you to do so in your future careers. We want to leave you with a few more words from Dr. Schweitzer, who said, "You asked me to give you a motto. Here it is, service. Let this word accompany each of you throughout your life. Let it be before you as you seek your way and your duty in the world. May it be recalled to your minds if ever you are tempted to forget it or set it aside. It will not always be a comfortable companion, but it will always be a faithful one. And it will be able to lead you to happiness, no matter what the experiences of your lives are. Never have this word on your lips, but keep it in your hearts. And may it teach you not only to do good, but to do it simply and humbly." With that, I would like to turn it over to one of our new fellows for life, Lita Wagner, who was selected by her cohort to introduce the 2021 fellows and give tonight's closing remarks.
Good evening, and thank you, Brooke. And congratulations to the 2021 fellows whose names you should see pop up. I'll know if they're coming. There we go. Congratulations to the 2021 fellows. In a moment, I'll ask the 2021 fellows to put on the ASF lanyard as a symbol that you are the current cohort. But while you find that, I'd like to share a few reflections. This has truly been an unforgettable year. I, for one, never expected to be a Schweitzer Fellow during a global pandemic, but here we are. Being trained to fight health disparities while COVID-19 rages all around us has emphasized the importance of the work we do in our communities. This year has taught us to expect the unexpected, and on behalf of our class, I'd like to thank Kristen Boggs and ASF for equipping us with the skills we need to address whatever challenges life may bring. As I mentioned before, I'm a law student in Tuscaloosa. I knew from the beginning of my fellowship that I would also often have to travel to Birmingham for monthly Schweitzer meetings. Before the pandemic began, Kristen taught me and the other fellows from Tuscaloosa and Auburn about this cool video conferencing software called Zoom. I figured I might have to use it a few times in case I couldn't make the drive to Birmingham. Well, I've used it for a few other things since then. All of us have been impacted by the COVID-19 pandemic in some form or fashion. We've persevered through personal and professional challenges. I can't think of a single person in my class who did not have to adapt their project in response to the pandemic. 2021 fellows, I'm so proud of you for having the courage to lead through these unprecedented times. Although you are entering uncharted territory, you are not alone. This year has sometimes felt isolating, but I feel much better knowing that I can lean on my colleagues in the Schweitzer Fellowship for guidance and support, not just this year, but over the years to come. 2020 fellows, we must remember that this is not the end of our year of service, but just the beginning of a lifetime commitment. As difficult as this year has been for us, it's been even more difficult for the vulnerable populations we've chosen to serve. The pandemic has exposed many socioeconomic, educational, and health disparities in American society. People have lost their jobs, their health, and even their loved ones. Now more than ever, it's important that we are compassionate towards others and advocate for public health. Each and every one of us on this call tonight has a role to play in addressing health disparities. We must continue to fight the good fight, even when it's difficult, especially when it's difficult. To our mentors, advisory board members, and of course, Kristen Boggs, thank you for supporting us over the past year. To the 2021 fellows, we look forward to seeing the impact you will have over the next year and in future years. And so it is my honor to officially induct you into the 6th cohort of the Alabama Schweitzer Fellows Program. Please place the lanyards around your neck and smile for a photo.
All right, 2021 fellows, if you will turn your video on, if you are able, we'd love to see your smiling faces too. All right, 1, 2, 3. I'm going to take a screenshot. 1, 2, 3. All right, thank you.
Thank you, Kristen. And with that, unless there's anything else that I'm forgetting, tonight's celebration is adjourned.